I'm Elizabeth Ciordia. It's August 3rd, 2024, and it's Biology 230, Anatomy and Physiology, and it's week 5. We're going to talk about the axials and appendicular skeleton. We'll start with the axial, which consists of 80 bones. We have the nasal, we have the sphenoid, we have lacrimal right in here, ethmoid is right behind the nose, zygomatic under the eye, maxilla, mandible, frontal, and then the vomer right inside the nose. And then for posterior view, we have occipital, parietal, temporal, and then the mandible here. And here we have the temporal, sphenoid, parietal, frontal, nasal, maxilla, mandible, lacrimal, zygomatic. Ethmoid is right in here behind the nose, occipital, and mandible. And then we have the inferior view, and it would be frontal, occipital, temporal, and then the ethmoid is right in there. And then we'll move on to the spine. So we have the first 7 vertebrae are cervical spine. The first vertebrae is atlas, and then we have 12 thoracic spine vertebrae, and then the last 5 vertebrae is our lumbar spine. And then we have the sacrum here, and then we have the coccyx right at the end here. And then we'll move on to the membrane of the sternum, body of the sternum, xiphoid process, and then the first 7 ribs are our true ribs, and then ribs 8, 9, and 10 down here are our false ribs, and then we have these 2 back here, 11 and 12, and those are our floating ribs. Now I'm going to move on to the appendicular skeleton. We have our clavicle here, then we have our scapula here. This is our humerus here, and then the ulna. Let me see. This is our ulna, and then radius, and then we have a ton of bones in our hand. This would be the pisiform here. These are the metacarpals, and then phalanges up here. Then right up here we have the sesamoid bone. And then we have a ton of bones in here. The hamate, triquetrum, lunate, scaphoid, capitate, trapezoid, trapezium, and that's it for the hand. And then I'm going to move on to the pelvic girdle, which is the ilium, pubic bone, ischium is down here. And then we're going to go down to the femur, which is this big bone here. Our tibia is this bone here, and then the fibula is this little skinnier one. And then we have our patella right in here for the knee. And then we have a ton of bones in our foot. We have the calcaneus here. Then we have the talus. Then we have the navicular, the intermediate cuboidal, medial cuboidal, lateral cuboidal, and then we have the metatarsals, and then the phalanges down here, and then the cuboid. And the disease I chose to talk about today is osteoporosis. It can develop if you have low bone mass or low bone density. It causes changes in the structure and strength of your bones, makes them weak and brittle. It occurs when the creation of new bone can't keep up with the loss of the old bone. There are 2 main cells involved, which is the osteoclast and osteoblast. Osteoclasts help dissolve old bone, while osteoblasts lay down the new bone minerals. They work together. They determine whether bones will be made, maintained, or lost. There's hormones that play a huge role in bone remodeling. It would be parathyroid hormone, estrogen, testosterone. And some of the symptoms are bad posture, fractures, risk for fractures, pain, and spine malformations. Thank you.